Hello, everyone. My name is Christina Franklin. I am a third year medical student at Ohio University Heritage College of Osteopathic Medicine. Today, I'll be presenting our case study, which is entitled A Rare Case of Duodenal Lymphangioma, and it is a comprehensive case study. So let's start by establishing what the lymphatic system is. As you can see from this diagram, the lymphatic system transports lymph throughout the body, which helps to filter harmful substances and waste. So you have the tonsils, the thymus, which are all part of the lymphatic system, and then you have the lymph vessels, which transport lymph throughout the body. The lymphatic system is vital for fluid absorption, fluid balance, fat absorption, and also to support the immune system. Lymphangiomas, on the other hand, are more benign and uncommon anomalies of the lymphatic system, and you can find them on the skin or mucosa layer. They can exist in the deep or superficial layers of the body, and then you can have various variations. They can be congenital or acquired. The congenital cases usually occur before the age of 5, and then acquired are results from disruption in the normal lymphatic drainage, such as in surgery, like in our patient today, or trauma or malignancy. Despite their infrequencies, untreated lymphangiomas can lead to significant health complications such as infection, bleeding, and pain. So, an even more rarer subset of lymphangiomas are duodenal lymphangiomas, which are arising from lymphatic vessels in the duodenum. Our journey begins with a 61-year-old female who was previously subjected to sleeve gastrectomy, presenting with symptoms such as abdominal pain, shortness of breath, nausea, and vomiting, and whose clinical presentation unveiled the presence of a duodenal lymphangioma. So, our patient's narrative unfolds with a series of troubling symptoms. She had a few months of abdominal pain, coupled with shortness of breath, nausea, vomiting. Despite many visits to the emergency department, her initial evaluation there failed to yield any significant findings. And she was then referred to gastroenterology. At Dayton Gastroenterology, which she was evaluated by Dr. Triplett, a gastroenterologist who used an EGD to reveal a very noteworthy discovery. He found a 1 centimeters raised nodule with a whitish plaque in the duodenum, and then it was biopsied and sent to pathology, which confirmed the presence of a duodenal lymphangioma, effectively ruling out any other potential differentials there. So on the left-hand side, you can see the microscopic examination by the pathologist, which showed the duodenal lympangioma mass. And you can see the little cavernous and cystic lymphatic channels that are engorged and enlarged and kind of interwoven, making it more disruptive to the duodenal mucosa. And then in the middle, you can see how the patient's duodenum looked like with the gastric uh, surgery. And then all the way to the right hand side, you can see a picture of the 1 centimeter raised whitish plaque. That was biopsied and confirmed to be a duodenal lymphangioma. So, upon confirmation of the duodenal lymphangioma, the patient was scheduled for a multidisciplinary discussion involving gastroenterology, surgery, and pathology teams. The treatment plan included close monitoring of the lesion size and appearance, along with a follow up endoscopy in 6 months to assess any changes. The patient was educated on the condition and its management, emphasizing the importance of regular follow up appointments to track the lymphangioma's progression. Additionally, dietary recommendations were provided to minimize any potential symptoms or complications associated with the duodenal lympangioma. The patient was reassured that with proper monitoring and care, the condition can be effectively managed and ensure a well-being and quality of life. So, in comparing of our findings with existing literature, it became evidence where our understanding stands and where there is room for growth. Wahid et al. In their 2022 case study, which was entitled A Rare Finding of Duodenal Lymphangioma in a Patient with H. pylori Associated Gastritis, they found a correlation between H. pylori gastritis and duodenal lymphangioma, hinting at a potential association between these two conditions. Their case study focuses on a 30-year-old male who experienced intermittent upset stomach over a year, partially relieved by a proton pump inhibitor. Physical exam revealed a mild tenderness in the epigastric region, while blood tests again showed no abnormalities. However, the EGD did reveal both H. pylori gastritis and a duodenal lymphangioma. So there you go again, a pattern. Tests were negative, but the EGD picked up the mass. So, treatment for this patient was different, and it involved a 14-day triple therapy consisting of clarithromycin, amoxicillin, and omeprazole, which resulted in symptom improvement. Notably, the lymphangioma was not surgically resected due to its small size. The patient was followed up for a year, during which his symptoms continued to improve. So, this case report underscores the importance of considering unusual factors in cases of duodenal lymphangioma and exploring possible connections with other gastrointestinal conditions. Duodenal lymphangioma have been the subject of various case reports and studies in existing literature. Through these publication, key findings, and observation, there has been a shift shedding light to the characteristics and management of these conditions. However, it is crucial to note that there's still gaps in knowledge that warrants further exploration and research. So, in conclusion, a holistic approach to diagnosing, managing, and monitoring duodenal lymphangiomas is crucial for ensuring the best possible practice and outcomes for patients. By working together and staying vigilant in their care, healthcare teams can help patients navigate this condition with the support and expertise needed for optimal health and well being. Our case study serves as a beacon, illuminating the obscure corridors of duodenal lymphangioma. Through meticulous examination and analysis, we have unraveled the clinical and histopathological intricacies of this entity. Our finding underscores the imperative of considering duodenal lymphangiomas in the diagnostic framework of gastrointestinal lesion, particularly in patients with pertinent surgical histories. So here you can see our references that helped us guide our case studies and help us to write our case report. And here are our acknowledgments. I just want to take a few moments to acknowledge State in Gastroenterology, Dr. Drew Triplett, Dr. Umi Mala, Chidori, and also everyone that's contributed to this research project and case study. I appreciate you. We all appreciate you. Thank you very much. Thank you for being here or for listening to this presentation. Again, my name is Christina Franklin. I am a third year osteopathic medical student at Ohio University Heritage College of Osteopathic Medicine. If you have any questions or want to engage in discussion, please feel free to reach out to me or the following contacts, and we value your participation and really eagerly anticipate a stimulating dialogue. Have a good day. Thank you.